Well, good morning, and it's really wonderful to be here with you all. You all serve such an important and critical role for the health and future of all Virginia, and I just want you to know that I speak for the governor when I speak today as well. We know what you do. We're parents. We care a lot about health care access for all, and I just want to start by saying thank you. Thank you very, very much for what you're doing, and thank you for lending your voice to advocacy with that legislature. It's really, truly critical. And just on the point of nurse practitioners, I don't know if it was said earlier, but my husband did have a secretary's bill with Dr. Hazel, who wanted to expand the scope of practice for nurse practitioners, but through the process, it has been severely watered down. But I can tell you, we'll keep going back, because we do believe that this is important, and that all alternatives, thinking creatively about healthcare access and broadening access, not limiting it, is really what we're all about. So I want to thank you again for the opportunity. Good morning, and thank you, Dr. Goodloe. I'm sorry we didn't have a chance to say hello. I just kind of ran in, but I know you all heard from Dr. Levine, our health commissioner, this afternoon at lunchtime, and I hope that was a wonderful conversation and delivery of an important substance that she is working on, and she's a wonderful leader, and my husband is very, very proud to have her as our health commissioner. So I'm sure she gave you a really powerful talk about how we can reimagine our communities and making sure that all have access to health care. So it is important to be with you all here today as you advocate for critical issues that you face, the nursing profession and health care on both the state and national level issues. It's really, truly important, and thank you for taking time out and time away from your jobs, your responsibilities, your families, to be here to advocate. As nurses, you are vital to the health and wellness of our communities, from schools to outpatient clinics to emergency rooms. Nurses work tirelessly, and I don't have to tell you all that, in every part of our community. You are the backbone of our healthcare workforce, and we are better for what you do. In my work to eliminate childhood hunger, I have had the opportunity to engage with many wonderful school nurses. The nurses in our schools are on the front lines of childhood hunger, engaging with students when they do not feel well because they've not had enough to eat. And sadly, there are over 300,000 Virginia children that don't have enough to eat on a regular basis. And when children don't have enough to eat, you all know, it manifests itself in many ways. They miss curriculum time because of tardiness, absenteeism, trips to the school nurse, and classroom acting out. Behavioral issues also are part of the scenario when children don't have enough to eat. Sadly, it's a sad statistic. You all probably know it. I wish I knew the Virginia number, but nationally, we know this is not just a Virginia problem. Only 45% of our public schools actually have a full-time nurse. And being the mother of 5 children, I know how important that school nurse is to the health and the well-being of our children and our students, but especially in those of our challenged communities. And those that are under-resourced are the ones that have cut back to part-time or sharing nurses between schools. And I think it's something that I will continue to talk about. It's very important in the work that I do. Your role thinking about school-based health care and delivery of services. Other states are doing that. Virginia should be a leader in that as well. California, Texas, Oklahoma. Virginia certainly should be one that is, I visited one clinic that's just opening in Norfolk at a high school, and the kids are so excited because it gives them an opportunity, those that are interested in healthcare, to look at it as a career option. And it also is serving that community, that challenged community that has working parents that have a hard time finding those opportunities, either through lack of healthcare insurance or access to time in their day to get their children what they need in terms of preventative health care. That's what's happening, but it needs to be larger scale, and it's something I'm very passionate about and would appreciate you all thinking about how that affects you and your efforts as well. For the past 14 years, nurses have been ranked the most honest and ethical professionals in America, according to Gallup survey. People trust you. For this reason and many others, nurses and nursing leadership will continue to be so important in our healthcare system. Nationally, one of every 45 potential voters is a nurse. So your voices are very important as we think about state, local, and national elections. There is no one better poised to advocate for the needs of patients than the nurses who care for them at the bedsides and beyond. And with so many Virginians unable to access even a basic level of medical or dental care, we need you to help care for those who have nowhere else to turn. And we need you to help by advocating for those whose voices would not otherwise be heard. We ask that you please continue to advocate for closing the coverage gap. In doing so, we will bring back more than $2 billion annually to the Commonwealth and provide comprehensive health care to 400,000 hardworking Virginians and their families. When my husband and I went down to the RAM Clinic, he's been for the last several years, and I was unable to go, but I went with him this year, and we took our school-age children with us. We saw the huge need for health care that exists in Virginia, especially in our rural areas. It's just not acceptable for thousands of Virginians to camp out to be able to see a doctor or dentist just once a year. We can and we should do better in Virginia. Nurses must be strong advocates for their profession. We don't have enough health care providers to meet the growing demand for primary care. Another way this manifested itself to myself personally was I served on a committee recently with our Secretary of Public Safety, which was looking into PERC kits, that is the physical evidence recovery kits that are collected when there has been a rape or sexual assault. And we had a number of untested kits in the Commonwealth. So we put together a study group, a work study group with many different stakeholders, victims, advocates, police, college campus representatives, our forensic science lab, many different stakeholders, but also forensic nurses were at the table. And the number of forensic nurses that we have in the Commonwealth, I can just tell you this, is definitely not enough. So there is a need for you all, for what you do, especially as we advance in looking at evidence and as medicine advances and looking at all the alternative ways that healthcare can be delivered. Your voice is very important, and we do appreciate what you do. But a great example of those amazing nurse practitioners we saw down at the RAM Clinic, as you all are very well aware, in the Health Wagon and what they do for those that wouldn't otherwise have access. So thank you. It clearly shows that you all care. You care in your daily jobs, and you care by being here. And I want to thank you for everything you do and let you know that my office, and I have a direct line to somebody else's office, is always there for you. We care about what you do, we care about the service you provide, and it is critical. We know that food is the best medicine, and so I hope that you'll join with me as well as we think about hunger in our communities. I know it's something that you see, but please do continue to have a great day today and continue to make your voices heard in every place that you possibly can. We thank you. Thank you for what you do.
Thank you so much. That was wonderful. We so appreciate all of the work that our First Lady does and the administration does and the husband in advancing the health care of all and well-being of all Virginians, and particularly her work as it relates to youth and children. So thank you again. It's time for lunch. So if you would go ahead and take a break now. I did want to let all of our poster, so make sure you visit all of the posters, the exhibitors, enjoy your lunch. We need to be back here by 1:30. Poster presenters, please make sure you break down right before 1:30 because we'll be getting the poster displays picked up shortly after that. Thank you so much.